Dix from Cuba continues to elicit sharp reaction from stakeholders in the health sector. Critics term the plan as ill-advised, considering there are over 1,000 trained and qualified doctors who are currently unemployed. We spoke to two such medics who narrate their pain and frustration of being unable to secure jobs with the national or county governments.
It's no mystery that Kenya's health sector has suffered a few blows. Doctors have especially been in the receiving end from poor pay to, ironically, unemployment.
Train and focus your focus elsewhere, because it seems by the evidence provided to us, our country doesn't need us.
Dr. Keegan, not his real name, orphaned at an early age, is a dentist who graduated from Moy University, but still is unable to secure employment.
It makes me angry. It makes me confused.
His frustration is shared by hundreds of other doctors like Dr. Jacinta Kala, also not her real name. Jacinta graduated 2 years ago from medical school, but is still tamarking, looking for employment.
The other thing I expected was that I would lead a decent lifestyle, that I would not have to be struggling to look for a job. Rather, I would be comfortable, able to meet my needs, my basic needs and those of my family.
The two medics loudly wonder why the government would commit resources to training them, then hire from outside while they are unemployed.
We want to outsource the human resource while discarding what we've trained for. Why are we training in the first place?
Unfortunately, with the devolution of healthcare, when we apply to the counties, we are not assured of getting, especially if it's not the county of your origin. You end up being discriminated.
Professor Lukoye Atuoli, the Dean School of Medicine at Moy University, says importing doctors from Cuba won't cure the problem in our health sector.
Every country has a need for specialists. Kenya has an acute need for specialists in certain areas especially. We solve it by identifying the gaps in the specialized areas where we need to fill in the gaps, and we fix it by paying. The government actually using money to pay for training of those specialists in those areas.
The government has defended its move to hire the Cuban medics.
These 100 gentlemen and ladies who will be coming to work in Kenya for a 2-year contract period will be coming to do two things. One, to plug a very obvious gap in terms of the specialized care. They will also be helping with capacity building.
This, however, makes no sense to the tamarking medics.
Because we wonder, then why are we studying? Why are we giving so much of ourselves in order to help Kenyans? Why are our services not being utilized?
The doctors here in Kenya acknowledge that indeed there's a shortage of specialists. Their only concern is that the government first utilizes them before it imports doctors from Cuba.
Let's stay with that story by Dr. Mercy Korir, and we're now speaking to Dr. Ouma Oluga. He's the Secretary General of the Kenya Medical Practitioners, Pharmacists and Dentists Board. Sir, thank you so much for speaking to us on KTN Prime this evening. So, Dr. Mercy Korir has just done a story basically saying there are about 1,000 doctors who are unemployed. The Ministry of Health says they will only bring in specialists to boost health systems in the country. We've just had the CS saying the doctors will be coming to fill gaps in specialized care and capacity building. What are your thoughts?
Thank you very much, Linda, for this story about the Cuban doctors. First, I would want to state that the manner in which the Kenyan government has engaged with the Kenyan doctors, I think is very wanting. It's like they show that they really do not appreciate them, yet these are Kenyans who have invested, who have used our public taxes to become doctors in order to help the country. And quite clearly, even with the current move right now to say that they cannot employ the Kenyan doctors who are qualified, right now we have 1,000 of them. In the next 1 month, we will have 2,000 of them outside there. and the counties keep saying that they do not have the budget, which is not true because they have the budget to employ these doctors. So far, there are even 700 vacancies at the counties, which have been left by the doctors who have left the counties in the last 1 year. Between December of 2016 and December of 2017, 700. So even that alone, filling that gap alone can already take care of these doctors.
So why,
that,
Dr. Luga, hold on. So you're saying there's a gap, there's vacancy for about 700 doctors. So why aren't the doctors who are now unemployed, as Dr. Masi posted, about 1,000 of them, why aren't they being taken up? Where is the problem?
There are two problems. The first problem is lack of planning. And the second problem is that the government and the counties, they think that they are punishing doctors, but I think they are punishing Kenyans. Because, and yes, I have to mention this, I think the relationship between doctors and the government has not been very good. And some people, particularly some governors, I think you saw this even with the issue of payment of salaries. And there are some government officials that keep telling us that, you can sign very good documents, but if we don't want to implement them, we will not implement them. So these are deliberate attempts by some individuals who are just angry with doctors, and some of them work very high up in the government offices. Some of them are even cabinet secretaries, and they're just insisting that they want to punish doctors. So they think that it's not good to employ doctors.
Okay.
Who do you think you are? So these are some of the problems that we face, and they're just ego issues.
Right, Dr. Luga. Just before we wrap this up, so is there any specialized training that you think the doctors from Cuba are bringing into Kenya that we currently do not have in the country?
First, I think also the issue of the Cuban government, the Cuba doctors, it's not new. Last year we saw the Kenyan government wanting to bring doctors from Tanzania. We blocked it in court. That court injunction is still active. But first is to say that the Cuban doctors, before they come here, any foreign doctor is expected to register with the medical board. And that registration is supposed to be only for 12 months. And that registration is supposed to state the discipline of the service that the practitioner is coming to render and the institution they're coming to render it in. So far, the medical board has not been involved. We have not been involved. So I'm not certain how the government intends to bring these doctors, because they're also supposed to have what is called a certificate of status or a certificate of standing, which is usually issued by the registering authority in the other country, writing to the registering authority in Kenya, stating that this doctor in the last 3 months or in the last 6 months has not had any malpractice issues. Okay. Part of the requirements for Kenya is that they must have a proficiency in English. So we don't have any indication that Cuban doctors have proficiency in English. So us as Kenyan doctors, we don't have a problem with any doctor anywhere in the world. And I think this should not be seen to look like Kenyan doctors have a problem with any other doctors. Indeed, Kenyan doctors also work elsewhere in the world. But I think the way in which the government is engaging in health policies is really needs to be rechecked.
All right. Thank you so much, Dr. Omo Oluga, Secretary General, KMPDU. Thank you so much for speaking to us on KTN Prime. You're watching KTN Prime. Thank you for staying with us. Let me take a break. When we come back, we look at the havoc that has been caused